Hey, Saul. Saul. Now, I've known Saul a long time. That was picked out of a hat. Joey, can you verify that we didn't fix that? The next question was picked out of a hat by a non-Casey staffer. Who wants to volunteer? Who is generally opposed to what I'm talking about? Who picked that? That guy in the back of the tan shirt? Sir, will you pick out the next one? Okay, get ready to pick out the next one. So I'll do that.
Thank you, Senator. First of all, welcome, and thank you very much for convening this forum.
Thank you.
I want to address the problems that nonprofits are having, especially small nonprofits are having as a result of health care that has not been reformed. We are already suffering from cutbacks in government support and private support, while at the same time, the cost of health care, providing health care for the employees of nonprofits continues to rise. The only way we can meet that rising cost is either to cut back services or to lay off staff. And so my request is that the bill would consider the effects on small nonprofits as well as small business. We are a business. We're required to run like a business and meet our bottom line. So we need the same kind of subsidy that is provided for small businesses to be provided for nonprofits. And thank you again for coming.
So thank you. I think we can, by the way, let me put a little commercial in my crack staff. They're good at reminding me of things. By the way, if you ever run a big organization, hire smart people and be a lot better off. The bill that I'm referring to, the Affordable Health Choices Act, the text of the bill can be found at help.senate.gov. Help meaning the acronym for Health, Education, Labor, Pensions Committee. So help.senate.gov. Even I can remember that, even though I didn't. In terms of my understanding, Sal, and someone can correct me if I'm wrong, but the way this is designed is that a nonprofit would be treated like a small business. How many employees are you talking about here?
Between 15 and 50.
15 and 50, okay. The way this works is, some people complain about this, but it's important to cover everybody. That every individual's got to enroll, and every business has to help us out. There'll be some business who will say, you know what, we just can't make it work. We've got 35 employees, and we just can't make it work. We can't provide any insurance for our employees. They're going to pay a penalty per employee, $70 to $50. But because, of course, we encourage them to cover it. We want them to do the right thing and let them cover it. They may not be able to do that. So they're going to have to help us, because if all their employees are going to be in the exchange in some program or part of the children's health insurance program, or some go to Medicaid, if someone else is going to be paying for their health insurance, I think that employer has to pay have their what we've called shared responsibility. I think that's a good way of saying it. But if you're under 25, so from employee number 1 to employee number 24, we have in this bill, and that's a lot of business. Probably most of the small businesses in America, well almost, in that category. Employee 1 to employee 24, if you have that size business, you get exempted from paying the penalty. It's a big help, I think, to businesses that are having that kind of trouble. I'm just going to walk through just a couple of points about our small businesses. By one estimate, this is the National Center for Policy Analysis. This is a February 11th, 2009 report, National Center for Policy Analysis. They state 18% of small businesses pay more than large businesses for healthcare. And as I mentioned, they also mentioned that 27 million of the uninsured being from those small businesses. And what what they have in, what we have in the bill is a series of credits depending on what category you're in. You can get a, and this would apply to both the under 25 and the over 25. So we're going to be giving credits to small business to help them out. $2,000 per employee for family coverage, $1,500 for couples, $11,000 for individuals. And what it does is it gives a small business owner, and by extension their employees, the same benefits that I have. The reason I can be part of a healthcare system as a member of the United States Senate that has a lot of options and the cost is reasonable for me is because I'm in a large and open purchasing pool. Believe it or not, there are millions of federal employees and their families across the whole country. And because of that massive pool of people, we can keep, among other things that are good, we can keep costs down, and you can disperse the risk. And I'm not an insurance guru, but even I know that. You got to spread the risk out so that the costs don't choke you. And then finally I mentioned the exemption for businesses under 25 from paying the penalty. Now if you go above 25 and say, now I got 26 employees, I got to start paying this per employee penalty. That goes up on a sliding scale. So if you have 28 employees and you think I'm paying the penalty, some other guy has a much bigger firm, you're not going to be paying the same number. That will increase as your employees go up. And we don't count seasonal workers. For those who rely on seasonal workers, we give small businesses a great debt. So that's a good kind of rundown. There's more I can say, but I want to keep going. But thanks for the question.